Good morning. Thank you for joining us this morning. My name is Mary Kelly. I am the Executive Director of the Academy of Ethics and Legal Medicine. And I have had the great honor of helping Dr. Sandbar. And unfortunately, Dr. Sandbar is unable to be with us this morning. So he has given me the honor of sharing his words and his kind greetings about his dear friend and colleague, Justice Noma Gurich. So I'm going to read what he has written here. So, honorable guests, judges, Provost Gary Raskob, distinguished faculty, ladies and gentlemen. The first annual A Day with the Judges conference began 37 years ago with the late Justice of the Oklahoma Supreme Court, Marion Opala, who served as his co-chair until his death in 2011. During the past 11 years, Justice Noma Gurich has graciously served as his conference co-chair, inviting justices and judges to attend and some to present lectures. It is my honor and pleasure to inform you about Justice Noma Diane Gurich. In 2011, she was appointed to the Supreme Court, District 3, by Governor Brad Henry. She is the third woman justice to serve on the Supreme Court of Oklahoma since statehood. She earned her Bachelor of Arts degree in Political Science, magna cum laude, from Indiana State University, followed by a Juris Doctorate degree from the College of Law at the University of Oklahoma. In 2016, she was inducted into the OU College of Law Order of the Owl Hall of Fame, and she currently serves on the OU College of Law Board of Visitors. Justice Gurich has the unique distinction of having been appointed to a judicial office by 4 governors of Oklahoma. She served as a judge on the Oklahoma Workers' Compensation Court for 10 years, a district judge for 12.5 years, and a justice for 12 years. The decisions she writes should not be forgotten. She has received numerous awards. A few are listed on this slide. In 2019, she was inducted into the Oklahoma Women's Hall of Fame. I have learned from her that we can only see a short distance ahead, but we can see plenty there that needs to be done. Justice Gurich and her husband, John, work hard at St. Luke's Methodist Church and also distribute Meals on Wheels, and she visits the sick. Surely something resides in her heart that is not perishable. To Justice Gurich, life is more than a dream. There is not a particle of life in Justice Gurich that does not bear poetry within it. She graciously guides the distinguished members of the Planning Committee with a Day with the Judges conference. And she reminds me of what Martin Luther King Jr. said: if you can't fly, then run. If you can't run, then walk. If you can't walk, then crawl. But whatever you do, you have to keep moving. She is a wonderful person who tells people, if you are always trying to be normal, you will never know how amazing you can be. So, ladies and gentlemen, please welcome our moderator and speaker, the Honorable Noma Gurich.
Thank you very much. Dr. Sandbar is a dear friend and colleague, and we have spent a lot of time together over the years working on these conferences, and it's been a great privilege for me to work with him and to get to know the members of the American College of Legal Medicine. And I'm letting Tyler here assist me in getting my slides going forward, and I appreciate that. Tyler is Dr. Sandbar's grandson, if you didn't already know that. And so we very much appreciate his help and his assistance here. Let me just start that I am going to go through briefly some statistics about the state of mental health in the United States, as well as a few comments on Oklahoma. The presentation is called State of Mental Health in America 2023. Dr. Sandbar assisted me in providing, we discussed these information and slides, and let me talk about some statistics. I am not an expert in mental health. You are going to hear from many people today who are experts in mental health for various and sundry reasons, by training and experience. I have been a judge for a number of years and worked with judges throughout Oklahoma for a number of years, and certainly a lot of things that we observe are consistent with what the statistics are showing. At this point in time, 21% of adults, approximately 50 million people in the United States, are experiencing at least one mental health illness. Of those, 55% have not received any treatment. Almost 5.5% of adults experience severe mental illness in their lifetime. There are 12.5 million people who have reported serious thoughts of suicide. This is an amazing number, actually. In Oklahoma City, there was a fairly recent evaluation, and just in our city, it is estimated that there are 70,000 people who have untreated mental illness. We show that the states with the poorest outcomes include Kansas, Arizona, and Oregon. Certainly Oklahoma is racing in the bottom of that number and has been for a number of years, but there are so many things that are now starting to happen in Oklahoma. Just acknowledging that we have issues has been a big thing. That's it. So I can get to slide 4, I think. Okay. So let me start with this slide at this point in time. And the rankings of Oklahoma, we are in the lower percentile. We have, according to this, we also have other states that are ranked from 1 to 13. They have higher rates of access to care for adults. And so that's the problem. A lot of the places in the United States, as well as Oklahoma, is our access to care. Okay, let me go forward here. So we have untreated substance abuse disorders, and that's certainly true throughout the country. We had a recent discussion of homelessness in Oklahoma, and we estimate that we have a very high population of untreated persons in that population. This is, I think this is intuitive, actually, that if you don't have access to actual professional treatment and medication, that you will turn to other types of substance for self-medicating. We see here that there are 11% of adults reported abusing alcohol, while 6.8% reported abusing illicit drugs. That's across the country. 7% are seeking treatment for their substance abuse disorder. Not nearly enough people in that category. We have, let me move this forward. So in September of 2022, the Health and Human Services Roadmap outlined its commitment to providing a full spectrum of integrated and equitable, evidence-based, culturally appropriate, and person-centered behavioral health care to the population it serves. We have some recent legislation in Oklahoma that has attempted to use some resources to develop programs to deal with what we're dealing with in Oklahoma. I wanted to also point out causes of mental health, of course, of mental illness, difficulties in accessing care, insufficient workforce availability, and interruptions in harm reduction programs, isolation, worsening economic conditions, growing mental health concerns. I saw an article recently that mentioned that at least 8% of adults in the United States, working? Hello? 8% of the adults in the United States are dealing with isolation. And so I can't, that's okay. And so that's part of the problem we're dealing with, especially since COVID. And I know we're going to hear a lot about that today. I think we've all recognized that there are a number of problems that have gotten much worse since COVID. There is a national maternal health, mental health hotline launched in 2022. There's a number here. We also have a mental health hotline for assistance now in Oklahoma City of 9888. All of these things, of course, are much more, they're much more inundated with people that need help than they probably can provide help. But we keep trying. There's a new publication that also targets the workplace more broadly, from traditional settings to places in community people go all the time. I wanted to also point out on college campuses, and we're going to hear from the Dean of the OU College of Law in a few minutes on some issues that she's seeing on the college campuses, as well as others who are teaching here at the medical center in Oklahoma City, and all of the issues that we are seeing. So there are publications now dealing with some of the studies. There is a number of resources available. I wanted to mention Oklahoma, particularly. We have a number of problems with youth mental health, and I know we're going to hear about that from another one of our experts this morning. But I recently went to a seminar that dealt with this and indicated that in 2017, 19% of the teens in Oklahoma reported seriously considering suicide. In 2019, that went up to 22%, and in 2021, it went up to 23%. So these are the students that are then going to be on college campuses. So there's a lot of information and concern about that. I also want to mention another thing that we're dealing with is, of course, homelessness. In Oklahoma City, the most recent census that was taken identified over 1,400 homeless people in the state of Oklahoma, about 1,000 of those in Oklahoma City. These censuses are taken every year at a certain point in time so that they try to do a survey and get some fairly accurate statistics. In that population, 42% are reporting serious mental health issues. There are, of course, homelessness is an issue all over the country, and stable housing is certainly high on the list. And part of the problem, of course, since 2020, the number of evictions, even in Oklahoma, have skyrocketed. I have been talking to judges who handle eviction dockets in Oklahoma, and in Oklahoma County, which is our largest county, we are approaching 18,000 the last couple of years of evictions, and this is at least 4,000 to 5,000 more than any of our highest years reported prior. I also wanted to mention that in the homeless population in Oklahoma, of the 1,400 homeless people that they've counted, 132 are identified as veterans, and we have many, many programs that divert veterans into other treatment. You're going to hear something about that also later this morning. But it's just a difficult issue to get everyone services, and services, of course, are very limited. This is the discussion about isolation and loneliness. There's a social isolation loneliness outreach toolkit that's available from HHS. Again, it's hard to get resources to some of the people that probably need some of this the most, and that is always an issue that goes on for all of us. So I think I have done enough to talk about some general propositions. As I mentioned, we have other folks who are coming up here who are going to be the experts in this field. I am here to learn as much as anyone else in the room. And I appreciate all of the assistance from all of the physicians and lawyers and judges who are part of the program today.